Assalamu alaikum. Welcome all to the Human Anatomy channel. In this video, I discuss anatomy of the lung, part 1. This is left lung. This is right lung. Right lung has 3 lobes: upper lobe, middle lobe, lower lobe. Left lung has 2 lobes: upper lobe, lower lobe. In the right side, 2 fissure is present: horizontal fissure, oblique fissure. In the left side, only 1 fissure is present: oblique fissure. This is anterior border, this is posterior border, this is inferior border, this is costal surface, this is the anterior border of the left lung, present cardiac notch, and this is lingula. Costal surface, there is a groove present due to the impression of the rib, and the elevated area is related with intercostal space. Sometime in the right lung, a occasional lobe may be present, known as the azygous lobe, and it is separated by the azygous fissure. It is occurred due to the faulty course of the azygous vein drained into the superior vena cava. This is the azygous fissure. So this is the medial surface of the lung up to this mediastinal surface, and this is vertebral surface. Here it related thoracic vertebra and intervertebral discs. Mediastinal surface is related with structure present within the mediastinum. This is apex and this is base of the lungs. And medial surface contain a depressed area known as the hilum, and this is the pulmonary ligament. This is the development of the azygous lobe. Normal position of the azygous vein. When its course is abnormal, it creates a separate lobe and fissure in the situated and connected with the upper lobe of the right lung. X-ray feature a curved line and a teardrop like azygous vein shadow. This is the azygous fissure and this is the azygous lobe, and this is the part of the upper lobe of the right lung. Superior vena cava, azygous vein, azygous lobe, azygous fissure. Some lung fissura is look like this and some lung fissura is look like this. You know, lungs is covered by the pleura. Pleura has two parts. This is parietal pleura and deeper pleura is known as the visceral pleura. So visceral pleura is continue along the fissure and cover the lobes separately, but parietal pleura just breathes the costal surface. So when parietal pleura is intact, it's look like this. When parietal pleura is tear, it's look like this. So this is the mediastinal surface. This is the vertebral surface of the medial surface of the lung, and this is the base, and this is another base. Costal surface and carbon particles deposition in the lungs tissue. This is cardiac impression. This is cardiac impression or cardiac area, because here heart is related. This is the relationship of the mediastinal surface of the right lung. This is left lung. In the right lung, more venous impression is present. In the left lung, more arterial impression is present. You see, in front of the hilum, superior vena cava is present, and left brachiocephalic vein and left subclavian vein is present. Just above the hilum, azygous vein, group 4 azygous vein is present. Azygous vein is drained into the superior vena cava. And behind the hilum, this is the group for esophagus. In front of the pulmonary ligament and below the hilum, this is the group for inferior vena cava. In left lung, just in front of the hilum, ascending aorta, above the hilum, arch of the aorta, and impression for left subclavian artery, and posteriorly the descending thoracic aorta and the lower part of the posterior part of the hilum, esophagus, is present. This is apex of the lung. It is covered by visceral pleura, then cervical pleura, and above the cervical pleura, this is the Simpson fascia or suprapleural membrane. So this is the landmark of the anterior border, posterior border, and inferior border. In the left side, the anterior border present notch. This is lingula, and this is the left base of the lung. Mediastinal surface, vertebral surface. This is the left lung, this is right lung, this is superior vena cava, this is left brachiocephalic vein. It is formed by the internal jugular vein and subclavian vein. And this is the cardiac area of the lung. This is cardiac area of the lung. So here heart is present. So heart is more present toward the left. So cardiac impression is more prominent in case left lung. This is ascending aorta, arch of the aorta, descending thoracic aorta. This is esophagus. This is right and left secondary bronchus. This is primary bronchus. Here this is the cardiac notch. So here heart is not covered by the lung and pleura. Lung is exposed here. Now relation of the base of the lung. This is right lung. Base is more deep in case right lung due to the large size of the right lobe of liver. And base of the right lung is separated from the right lobe of the liver by right dome of the diaphragm. The left base of the left lung is related with left lobe of the liver, stomach, and spleen, and it is separated from this structure by left dome of the diaphragm. So in chest x-ray, this is the apex of the lungs, this is first rib, this is right dome of diaphragm, this is left dome of diaphragm. Right dome of diaphragm is superiorly present because the large right lobe of the liver. This is liver. This is fundic gas. This is fundic gas present within the stomach. This is fundic gas. This is spleen. This is liver. This is the base of the left lung, base of the right lung. And this is the posterior border of the lung related with thoracic vertebra and intervertebral discs. This is the cross section of the thorax. You see, this is heart, this is thoracic vertebra. So this is the vertebral surface and rest of the surface is the mediastinal surface. And this is the cardiac area, and this is another cardiac area, and this is costal area related with rib and intercostal space. Here upper level cross section, this is superior vena cava, this is arch of the aorta, the related in the mediastinal surface of the lung. Now the anatomical position of the lung. Apex is directed upward, hilum is directed medially. Right lungs contain 3 lobes, upper lobe, middle lobe, lower lobe, divided by oblique fissure and horizontal fissure. Left lung contains 2 lobes divided by oblique fissure, and it bears a cardiac notch at its anterior border. So this is all about part 1. Thank you for watching. If you like this video, please press the like button. Please subscribe my channel. Thank you for watching.